Hello and welcome to all of our viewers from around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome to all of you joining us again today. If you're here for the very first time, we're just so happy that you've been able to join us. I've got many friends and colleagues here today to introduce to you, and we'll be chatting with them in just a moment. But today we're going to be talking about our Gold Lactation Online Conference 2022. That's right. We're already started that conference, but don't worry, you're not going to miss out on anything. There's lots to catch up on already. And of course, we've got some of our live events coming up. So if you're interested in coming to live events, they're coming up next week and the week after. You'll have to check the schedule though. Of course, all coming in from different parts of the world, different time zones. I don't want to mess anybody up. We've got many people here today. We're all in different countries today. And we've just been so excited. We've been working a little bit together, talking about collaborative work. So head on over to the website at goldlactation.com. You'll actually be able to check in. Melissa Cole, who's here with us today, just did a fabulous keynote presentation at our online conference. And that is up and ready for you to listen and learn. And I know that you're going to love that presentation. Now, today we're talking about our collaborative care, which is really exciting. It's sort of really lent to a lot of this conference. Everyone's been talking about collaborating. And so this is our panel discussion that we're going to talk about today. And it is titled Ensuring Collaborative Lactation Care for Optimal Outcomes. All right. So it's a great topic title, and I know that you're really going to love it. Now, let me tell you a little bit about the panel. We invited our esteemed guests who are here with us today, who are going to be a part of this panel, and they're going to be discussing all the different elements related to collaborative care from their perspective, from their communities and their point of view. All right. So, and as I mentioned, all in different countries here, which is just great representation at, of course, our international conference, which really excites me. But without any further ado, I'm going to bring our guests in and ask them just to introduce themselves briefly once again, and of course, tell us which country you're in. And then we'll get into a little bit of the topic. So let's start with Dipti Shah. Welcome back. It's great to have you here today. Please introduce yourself and tell us where you are.
Yeah, thank you, Fiona. So I'm from India and I'm Dipti Shah. I'm a lactation consultant. So I was certified as a lactation. So initially I was from the non-medical background. So I was just a mother. And I have one son, and my son is 25 years old now. So when I delivered, initially I was just, I was a dairy specialist. So I was working in a dairy industry. And then I thought that, rather than working with the dairy industry, I should work for the mother. So I joined this organization, BPNI Maharashtra. And then I become a mother support group leader initially. And now I am a lactation consultant since 2010. And now I'm working in broad spectrum, like working with municipal hospital also and working with corporate hospital also. And with the BPNI Maharashtra, I have a large experience. So I'm training to a grassroots level workers also, and I'm training to medical staff also. So this is about me. Yes.
Oh,
Thank you, Fiona.
I can't get enough of your story, honestly. Dipti, it just makes me smile every time of your journey into the lactation field. And I know that you work with so many amazing volunteers and workers in India. So thank you so much for sharing and being here today. Anna, please go ahead.
Thanks, Fiona. So I'm Anna Lagrange. I'm in the UK, down in the bottom corner in Kent. And so I'm a lactation consultant. I'm also a pediatric nurse, and I'm a meditation mindfulness teacher. So generally, I provide education to other people who work in lactation around bringing mindfulness, relaxation, positive psychology into their lactation work. But this is actually a subject very close to my heart because as a nurse, we call it here multidisciplinary teams working is so big, and it's always been a big part of my work. So when I first became an IBCLC in 2015, that was something that was very important to me. So I'm thrilled to be talking about it here today. Thanks for having me.
Oh, thank you for joining us. And I know you've got big things happening because I know you're living in the UK right now, but just keep us up to date. What's happening very soon for you?
Yeah, just for a few more weeks. My husband is South African and we're moving over to Cape Town, the whole family. Yeah, next month. So that's pretty exciting and I'm very excited about yeah, using my lactation skills over there and supporting a new community.
Yeah, well, good luck with your big move, and you know, it's going to be such a blessing to have you in South Africa. I know that you're going to be working collaboratively very soon, right, as you move forward. That's awesome.
I hope so. Thanks, Fiona.
Melissa, welcome back. It's good to have you here. We had a great experience with you just last week as our opening keynote presenter at our GOLD Lactation Online Conference. Thank you for joining us here today.
My pleasure. And the keynote was so much fun. It was great to connect with and collaborate with people all around the world as we did our detective work, troubleshooting cases. That was a lot of fun. I'm in Portland, Oregon, where the sun sometimes comes out. It's just starting to become spring and the weather's getting a little bit nicer. But I am a board certified lactation consultant. I'm also a clinical herbalist in private practice. And so there's ample room for collaboration in my work on many different fields. And I have a practice where I do work with many parents and infants who have special needs, and this lends itself to a lot of collaboration. I'm lucky to have many different disciplines in the Portland metro area to sort of collaborate and work with. And I know that's not true everywhere. So I'm all about being creative and resourceful and continuing that detective work as we figure out, how do we make these connections? How do we get families the care they need, right? How do they access that care? What does that look like for them in their path? So I think that this is going to be a great topic.
Oh, absolutely. I mean, just listening to the three of you right now, can you hear the diversity in, you know, all of what you do and where you are? And now I just want to work with all of you collaboratively. I just love it. And I know, I mean, I have had the privilege of meeting you all before, and so have a little knowledge in your background, which is fabulous. But it really does excite me. And that's why, of course, we wanted to invite you to be part of this amazing panel. Now, during the session, if the viewers are not familiar with how the panel works, we're going to be tasking our panel here with some questions about collaborative care. And the idea is that they're going to be sharing their experiences of how, you know, things have worked for them through different, you know, different situations and so forth and so on. But it's meant to put that lens on, you know, how we can improve things and what we can do better, you know, in our communities. And so, you know, again, having different perspectives from around the world, there might be some things that we're doing better in other countries that we really want to sort of bring to our own local networks. But of course, we invite you, all of our participants here at GOLD Lactation, to come on board with this. We want you to be there too as part of this collaborative talk, and bring your experiences and bring, you know, all the things that have worked for you. Perhaps you've been able to set up successfully in your area. Or perhaps you're just new to the profession, and we love it, you know, to share our experiences with you as well. So everyone's invited to this panel discussion, you know, at our GOLD conference as well. Now, I just have a quick question for our guests here today. And that's really just to share, you know, maybe one thing that, you know, that you like about collaborating, or something that has become, you know, important to you over the time that you've worked with others. Now, I think I was going to, perhaps anyone can sort of jump in here. Does anyone have an answer burning that they want to share with me right away?
I'll comment.
All right.
I feel that there is no way we can be everything, right, that a family needs. We have to reach out. We're an allied health care team member, but it often takes a team for the families we serve. And many of us see a lot of compromised babies dealing with a lot of issues, and their parents as well. And it really does take a team, right, from all aspects of physical well-being, mental health support, and everything in between. So I think that we can't be everything that a person needs. We need to know who we're referring to and when, and it takes a village. Yeah, it takes a team.
Oh, I love that. And I was just thinking about the times where sometimes I felt very isolated as a lactation consultant in working with a family. And, and sometimes it's hard to, excuse me, to actually not necessarily refer them out, but actually entrust the families to know that you cannot provide everything to them, and it's okay for them to move to other professionals as well. So convincing the families that it's okay, because I think there's some mistrust sometimes when they come to us, that they've worked maybe in an environment that no one has perhaps listened to them. So now we want to share some of that. But of course, it takes a village. It takes a village to raise a family, for sure. Who else has something that you would like to share on that topic?
I mean, my favorite thing about collaborating is there's just so much to learn, and I love hearing about other people's disciplines and their skills and their knowledge, and how that interweaves with what I've been doing with a family, and just working on something together. I find it really exciting. I don't like feeling isolated like you were talking about, Fiona, especially sometimes on a tricky case. It's really nice to be able to work with somebody else as part of that team and learn from them as well.
Yeah, absolutely. Yeah, there's just so much to learn all the time, and sharing the load and learning more is what I'm hearing so far in kind of what we do. Dipti, do you want to wrap things up for us? We just need you to unmute.
Yeah, sorry. So
That's okay.
basically, yeah, with the non-medical, as a IBCLC, there are a lot of times that, we have to refer the patient to, and we have to collaborate with some physician or a doctor. And now we have become a lot of friends also, so that we have a lot of friends, they are physicians and they are breastfeeding friendly only. So I feel that you should create your own team. And whenever you have a tongue tie baby, for example, you should have your own team that, yeah, I know this is the person who is breastfeeding friendly also, and he will take care of the baby's tongue tie also. So similarly, in each and every case, I feel that we should create a team and we should be very friendly with each other, so that the patient get the best care, and then we also feel that, yeah, this works very nice. Yeah, but sometimes it can be possible that even if you want to send the patient to a known person, but the patient have or a mother have their own choice that, no, I don't want to go there, I want to go to some other person. That time, yes, it's a difficult task. Then you have to consult that doctor, you have to talk to them, sometimes the evidence based references and lot many things, but it's enjoyable thing. You create more and more friends. This is what I feel. This is how you get, your group will be enlarged, and you have many more doctors in your group. So yeah,
I
this is
love
the,
that.
yeah.
Yeah, I really like that. I hear that. What I heard you say was that sometimes you can, when you have your own network, it's like a big family, and you get used to referring out to those
Yeah,
people because that they're aligned with you. They have the same type of
yeah,
rhythm in how you work and those types of things. But sometimes new people come into your network,
yeah,
and so then you have to start over and build those relationships again. And you know
yeah,
what? Sometimes I get really comfortable in my own network, and having
yeah,
to go outside of it can be hard. And I have my own mistrust, right? I have my own bias. So
yeah,
it's very interesting, but it's good to be stretched all the time as a practitioner. I mean, we need to continue to grow and learn,
yeah,
and that's just another way. That's another way of collaborating. So that's wonderful. Well, thank
yeah.
you, my friends. You guys are awesome. I just love hearing from you and chatting about this particular topic, and all your perspectives. I'm really looking forward to spending more time with you, of course, on our panel. And that's coming up. You can check out all the details online. The topic of this panel, the topic title is Ensuring Collaborative Lactation Care for Optimal Outcomes. And of course, I know we're all very driven for that. Now, you can go to the website right now, goldlactation.com. Check it out. For most people, it's going to be on a Wednesday, the 27th of April. I'm just looking at it on my own website right now, but you know how to get there, right? Check it out. And you'll see, of course, go and read up on the abstract and the bios of all these amazing folks that are going to be online with us that day. Well, thank you once again to all of our collaborators collaborators today. We've got Melissa Cole, Anna LaGrange, and Dipti Shah. Thank you for your time today. We appreciate all your hard work in the community, and we'll look forward to having you back online very soon. And of course, to all of our viewers, thanks for chiming in today and being with us. Don't forget, you can leave comments below. Maybe you've got some questions that you want to ask these amazing folks right now, and it could be part of that actual live event. So we'll look forward to hearing from you very soon. Have a wonderful rest of your day, everyone. Bye-bye for now.